with me today Tahir Farid. Tahir is a doctor of dental medicine who founded ProDental. ProDental is a think tank and global brushing and flossing awareness campaign. He joined Temple University School of Dentistry in Philadelphia and is currently one of the mayor volunteers in Philadelphia City and is working on dental machine vision project at IBM Watson. Tahir Farid is giving us a keynote about telehealth, technology meets healthcare.
Hello everyone across the globe. Discussing the topic telehealth, it's very unique and the adaptation of telehealth lately, especially in the past 1 year, had been advanced so fast. Looking at telehealth, first let's define the word digital, which is expressed in one and zeros, where one is a positive express and zeros is a non-positive express. That take us to the understanding of the cognitive bandwidth itself, where we have the cognitive bandwidth is actually the amount of thinking per time, which lead us, if we look at some of the numbers we're having nowadays, we do have over 200 active clinical trials, 200,000 clinical trials nowadays, and we're having 21,000 of drug component. Among them is over 300 unique one of them. That lead to over 1.8 million of new articles nowadays. But that leaves us with a very unique analogy where humanity or scientists nowadays will not be able to keep up with the new science in their domain field. Now let's go back to telehealth and understand that telehealth itself is the transfer of information through ICTs, and this information could be diagnostic information, it could be treatment information, it could be scientific or academic information as well. Telehealth itself is not young in the sense that it started in the 60s through the transfer of information in telephone wires, which is telephone wires, telehealth. There is some challenges having such thing, and as we see here in the United States, there's some areas and some pockets where there is no broadband where implementation of telehealth will be challenged. That's because there are mountains, forests, and deserts. Here in Philadelphia, we are very proud of CHOP Hospital, with Children's Hospital of Philadelphia, which leading and paving the way in telehealth through the release of their pilot program in telehealth. But let's take a look back in the 1903 until 2019 and adoption of some of these technology in the household in the United States, for example. And we see that vocal recognition had been gaining a tremendous amount of advancement, and nowadays we see that Siri and Google, these search and actually is backed up by artificial intelligence nowadays. Looking at the industrial revolution itself, and we see that with the shift, with the new emerge of new energy, there will be a shift gear of industrial revolution. And nowadays, if we really look, we do have the fourth industrial revolution, where augmented reality, cloud computing, and even 3D printing and the smart sensor that infuse in these 3D devices is very common. We remember Dr. Klaus Schwab when he advocated for the fourth industrial revolution and that it will be part of our everyday lives. Digitization nowadays is not a tool for differentiation anymore. COVID-19 had hit us from all aspects as well as healthcare, where we can see there is a big reform going on and where there is the move toward health for all, and we see as well the big squeeze. Looking at the way how we see light and how light literally attracted us, we look here at Dr. Max Ludwig, and he's the originator of the quantum theory, where the release, transfer, and absorption of light through the amount of quanta, which later in the days had been adopted by Dr. Albert Einstein, where the quantum theory came to life, followed by the maser and the laser through Dr. Mayman, and we see that laser nowadays can be transferred and moved to a different spots. So literally we can shine a light inside a human being in any organs and get a very meaningful information from there. Looking at the light spectrum itself, we do have the visible light and we do have the X-rays and ultraviolet on one side, and we do have the infrared and the microwave on the other side. On the ultraviolet, we see that sterilization and many of these robotics nowadays will be in a hospital, will be the norm for humanity to adopt. On the other side, we see that the infrared itself, it had the near, mid, and long infrared, where we do have the reflective. When it comes to the infrared, we do have the reflective, which is the near, the short, and we do have the thermal infrared, which is the middle, and the absorptive. And looking at how can we get a meaning information from these from the light itself, whether it's a reflective, thermal, or so on. Many of the example of getting vital signs through reflecting light through a skin, for example, the face, the fingers, or the earlobes, it's leading us with a very meaningful information nowadays. Like we have the heart rate, the blood temperature, the respiratory rate itself. The cardiac output, it's part of it. Even nowadays, we see that the emotional gathering of a subject, it's pretty normal nowadays. How can getting some of these information make a lot of sense if we really think about it? And how can these alleviate the burden from the healthcare or the healthcare providers? So if we really look about the penetration of these light inside a human skin, we look at the infrared where it has the highest potential of penetration where it reaches the hypodermis, where we have the blue light which reaches only the dermis. And even a combination between these light will lead to a very meaningful information, leading us to a contactless imaging and monitoring application that could be in the neural field where you are monitoring the brain function or even gathering a further information. The face, the fingers had been a way of gathering this information, and if we really look, while we have a facial detection, PPG, and then a filtering of all this followed by a histogram analysis, that will lead to a very meaningful information for the patient and for the doctor as well. Bina is one of the companies that had an advancement in the field which they launched their application in, and it's pretty useful. Looking at the potential of having many of these light categories, I said, or light wavelength, we see that the temperature and the metabolism can be addressed through the infrared light, and it had been used also in neonatal. Reading about or the finding about oxygen saturation itself and the perfusion, blood perfusion and hemodynamic monitoring, it had been used through near infrared imaging. And in a short wave of infrared, we can see that we can even have a blood vessel imaging, which is very important in the study of blood vessel and hemodynamics. The mid and long range or of infrared, we do see that it comes to the stress imaging as well and the emotional classification. Monitoring the blood or the hemodynamic is very important for a healthcare provider. But if we really look of how we can gather some of these data, the index had been a very good way of gathering these data. It seems like the bones in the phalange, the distal phalanges, had been a problematic somehow, leading us to finding another way between and getting our information through a different way. Instead of transmission, we'll do a reflective gathering of information. And so far, it had been very fruitful of having a reflective rather than a transmission gathering of data. The skin itself is very important in gathering these data, and that's opened the gate to a many wearable devices nowadays that can help the patient and the provider at the same time in gathering these informations. The additive manufacturing is paving the road and considered one of the accelerator of wearable devices. And the infusion of smart sensor for these devices even making it make its way for a fast adoption. If we really think about the 3D printer shipment that happened in 2013 and 2015, we see this a huge climb in 3D shipment. Matter of fact, we see that the shipment between 2015 and 2020 it went from 200,000 all the way to 2.4 million in just 5 years. The wide adoption of such devices will open the gate to IoT and wide adoption of IoT eventually. It's happening actually right now. Telehealth itself is not a one way, we can have a nowadays of tele-robotic health. And as we can see in DaVinci, which is one of the companies that had making a huge amount of advancement, and that since 1999. In 2000, there was 1,500 US hospitals that used the DaVinci system. The DaVinci system itself has a less blood loss and we have a less scarring, and therefore we do have a quicker recovery. These devices is very expensive if you really think about it. It's not because the device and the operation itself isn't expensive. It's because the training individuals and training surgeons for such devices will make it very expensive. So having artificial intelligence somehow will alleviate the burden from physicians, especially with the increased amount of population we're having nowadays, and open the gates for them to learn more about telerobotic surgeries. There is a many disruptive scenarios that happen nowadays. But there is also technological foundation like the internet, the social mobility, the cloud computing. There is the accelerators as well, which is the 3D printing and the renewable energy. The internet things and the cognitive smart system as well, which will lead all the way to health life expectancy, which is actually increased by 12 years. The hype cycle, looking at the hype cycle itself, we reached the point where we're having a swallowable technology, which is very important. That takes us back to the definition of digital, which is zeros and one. That had evolved literally to a new way of looking at zeros and one, which become the intent, entities, and system for artificial intelligence. It might sound foreign to humans, but then for artificial intelligence and machine learning, that's a very meaningful data. All these wearables and adoption of IoTs will leave us with a huge amount of data that like in varieties, velocity, and volumes, which leave us with a very important fact that artificial intelligence will be a way of expanding healthcare rather than a way of contracting healthcare. Thank you so much. This is just the beginning and it's not the end, and it's been a pleasure. Thank you again.